Well, I'm here today with Peter O'Donnell, former mayor, youngest mayor in Portland ever, and a healthcare provider who will be overseeing the new $1.8 million grant that the city's getting for obesity prevention.
Yes.
Tell us about that, Peter.
Well, thanks first of all for giving us a chance to talk about this,
Yeah.
Leslie. As you can imagine, obesity is just a national concern, certainly a concern for us here in Maine and in Portland. 26% of Mainers are obese or overweight.
Oh my
One in
goodness.
3 children in the kindergarten grades in Portland schools are considered overweight or obese. 1 in 4 people walking our streets in Cumberland County are obese or overweight. So there's different kind of geographics in terms of ages, but it's pretty startling, and we have to do something about it. We have a very aggressive and active plan to do something about this issue right here in Portland. We're working with the schools. We're working with our partner, Cultivating Communities, to increase farmers markets and people's access to farmers markets. We're working with our partners with the United Way to start earlier, to reduce screen time for children, to get them more active and out on the streets and out in the world being more active. The schools, the plan is to put a salad bar in each school in the city of Portland to increase physical activity for each child that goes to school in Portland, to produce videos by the Red Claws and some other organizations that would be activity videos to get kids up and moving when the weather's not doesn't provide for them to be outside. So we're excited. We are all about, with this grant, environmental change and policy change. And just recently, the City of Portland City Council adopted a resolution that says we're going to lead as a city, we're going to have an interdepartmental task force, and we're going to make changes within our city that reduce obesity, and then hopefully get other businesses and community leaders to join along.
And I know you're also partnering with Portland Trails, and we're fortunate here in Portland because we do have all set in place, a trail system right in the city.
We do, and Portland Trails is another partner of ours. They have, it's just amazing what they've done in the past 20 years in terms of increasing the trails. I was out walking on one yesterday, and it just went on forever behind Capissick Street. But what we want to do is also create a complete streets policy. This policy would make all streets, and this has really been duplicated in other cities, especially in Washington. It makes all streets user-friendly for all of the potential users, not just buses and cars, but also for people who are walking, people who are biking, strollers, all of the different uses. So we're going to bring forward, hopefully, that the council will bring forward and support a complete streets policy for the city.
And you
of
were
Portland.
just recently in Washington observing how that works.
We were. Our leadership team was there, and it was a national conference. There were so many good presenters about prevention, and that's what this grant allows us to do. Is this $1.8 million really is going to lead to more preventative efforts. If we don't get hold of our healthcare costs very soon, it's going to be a healthcare system that's out of control. So that's why the investment is not only going to create jobs, but it's hopefully going to do preventative work that reduce healthcare costs on the other end.
And the sort of holistic idea of it, everything affects everything else we do. I mean, if we don't have our health, we don't have anything. If we're not eating right, we don't have our health, and we can't do this,
Right.
What about the schools? So you're going to be starting this in kindergarten from the beginning, at the base level.
We sure are. We're going to increase physical activity for all kids in the Portland school system. We're going to provide more 30 minutes of physical activity, physical education.
Every day?
At least 3 times a week. That's the goal, but we want to increase that as time goes on. But being able to do that and make sure that's a regular occurrence would be a big help. Reduce children's screen time. Oftentimes kids, when they're just starting school, they're on computers a lot, they're watching TV. We want to get them away from the screens and out and and enjoying some kind of physical activity. In the wintertime, when people go in the state of Maine and some of the cold areas of the country, we want to provide more outdoor activities for people and encourage them to get out and become more physically active, and in the end, reduce the health effects of obesity. It's the second biggest killer of people in the United States is obesity because of all the other complications that it generates.
And here we are. Do you know where we rank nationwide as far as obesity goes?
We're right in the middle. We're right about 26, 27. But you know, that just the fact that we're 26% of our population is a staggering number.
It is.
And you know, that doesn't say a lot about some of the other states. But we're right in the middle. We need to be, as we have improved in so many other areas, we need to be in the top in terms of obesity prevention.
And here we have the perfect state to set the example for the rest of the country.
Yes, we do.
We have the resources right here, and now we have you to facilitate. So thank you, Peter,
Thanks,
for being
Leslie.
here.
Thanks for
and
your
I
time.
hope we'll be able to talk more about this
We'd love
in
to do
future
that.
shows. All right.
Okay.
Back
Thank
to you,
you.
Tom.